If you're a new parent, you know that sound. That persistent, almost heartbreaking cry that can make you feel completely helpless, stressed out, and, well, totally confused. You feel like you've tried everything and still the crying just keeps going. So, in this explainer, we're going to decode those cries. We're going to figure out what your baby is really trying to tell you.
There's this old saying, and let's be honest, in those moments of pure, bone deep exhaustion, it can feel so frustratingly true, right? But while it's a feeling we all share, it doesn't really help us get to the bottom of things. Because that cry, it isn't just noise. It's their language. It's the only way they have to communicate with you. So the key here is to shift our perspective, to stop seeing it as just a problem and start seeing it as a message. And that's our goal here today, to give you the tools to become a cry detective.
Okay, before we dive in and start investigating, we really need a baseline. Like, what does normal crying even look like? Just knowing this can be incredibly reassuring and, honestly, can help get rid of a lot of that new parent anxiety.
Here's some really good news. Infant crying actually follows a pretty predictable pattern. It's not endless, I promise. Take a look at this timeline. It hits a peak right around 6 weeks, and then it starts to decline as your baby finds other ways to interact with the world. And by 6 months, you're looking at hours of happy gurgling. So if you are in that 6-week peak right now, just hang in there. This proves there really is a light at the end of the tunnel.
And just to put a number on it, the average is about 3 hours a day. 3. When you know that, it can really help you recalibrate your expectations, can it? If your baby is crying for this long, it doesn't automatically mean something is terribly wrong. A lot of the time, it just means they're being a perfectly and, yes, frustratingly normal baby. So, okay, what's the line between that and something more serious? On the left, you've got your normal crying, that 3-hour average that follows the curve we just saw. But excessive crying, that's different. It's for long, long periods, happening at times when the baby should be playing or sleeping. And this is a tough but really important point. Our own frustration, which is so understandable, can sometimes make it worse. All right, now that we have that baseline, let's get practical. Let's move on to your new best friend, your investigation tool. This is a checklist you can run through the second the crying starts. Here they are, the 7 most common culprits. Think of this as your first pass investigation, right? We're going to look at everything from the simple stuff, like hunger and a dirty nappy, to the trickier things, like colic or reflux. So let's break down what to look for with each one. So let's really dig into that checklist, because knowing the specific signs for each of these causes, that's what turns you from a worried parent into an empowered problem solver. First up, hunger. Underfeeding is a huge reason for crying. Now, your baby can't say, "I'm still hungry," but their body can give you clues. The key things to watch for are slow weight gain and small, firm, dark green bowel movements. If you see those signs, it's really, really important to check in with your doctor or an infant nurse. Next, the one that many parents just dread, colic. Now, the most important thing to know about colic is that while it is so distressing to watch, it's actually a harmless condition. And look, you can see how it maps almost perfectly to that crying curve we saw. Starts around 2 weeks, peaks at 6, and it's usually gone by 16 weeks. It often has a classic pattern too. Really intense crying, usually for about 3 hours in the late afternoon. Okay, this is a super helpful comparison because it is so easy to confuse teething with something more serious, like an ear infection. For teething, the main sign is a swollen, sore gum, and the misery usually passes in less than a week. An infection, on the other hand, well, that often comes with other signs, like a fever or a runny nose. You might see the baby pulling at their ear, and that's not something that's going to go away on its own. It needs a doctor. The other causes on our list are a bit more straightforward, thankfully. Could they just be lonely? Well, here's the simple test. Do they stop crying when you pick them up? That was probably it. A wet nappy is just a quick, easy check for discomfort. And then there's reflux, which can cause real pain. That might require a chat with your doctor about different feeding techniques, or maybe even medication. Okay, so you've run through the checklist. Maybe you have an idea of the cause, or maybe you're still totally stumped. Either way, you need to soothe your baby right now. So let's get into the action plan. But first, before we get to the techniques, a really crucial message just for you, the parent. And this is so important to hear. These crying episodes, they are not your fault. It is so common to feel like you're failing when you can't stop the tears, but that is just not the truth. You are doing an incredibly hard job, and you need rest and support too. All right, now for a proven strategy from pediatrician Dr. Harvey Karp that you can use immediately. It's called the 5 S's, and it's all about recreating those comforting sensations of being in the womb. First, swaddling, nice and snug. Then, holding them on their side or stomach. Third is shushing, and you have to make the sound as loud as their cry to cut through the noise. Then, gentle swinging from side to side. And finally, sucking, which triggers a powerful calming reflex. So you've tried the checklist, you've tried the 5 S's, but something in your gut still feels off. That parental intuition, it's a powerful thing. So when is it time to stop investigating and get a professional involved? The guidelines here are actually pretty clear. If you're worried and you just cannot figure out what's going on, call the doctor. If you've tried all the soothing remedies and nothing is working, call the doctor. And absolutely, if you notice any unusual symptoms, like a fever or a sudden change in your baby's behavior, trusting your gut and making that call is a sign of great parenting, not failure. So what's the biggest takeaway from all of this? We've spent our time breaking down crying into checklists and causes, and that's all super important stuff. But maybe the biggest shift we can make is in our perspective. What if we stop seeing crying only as a problem we have to solve and start seeing it as the very beginning of a lifelong conversation with our child? A conversation that you, right now, are becoming an expert at understanding.